Greetings. This article looks at the long-term outcomes of living kidney donors. The importance being, of course, that living kidney donors go through an operation that they don't need for their own physical benefit. And that operation has risks like any other operation. The reasons we do the surgery is that the risks are minor. However, there is concern about long-term risks. I'm Dr. Arthur Meadus, a professor of surgery at the University of Minnesota. And the title of our article is Long-Term Medical Outcomes of Living Kidney Donors. And my co-author on this article is Dr. Andrew Rule, who's a professor of medicine at Mayo Clinic, Rochester, Minnesota. The concern about long-term medical outcomes is really related to the fact that in the chronic kidney disease population, reduced kidney function is associated with a number of complications, including progression of kidney disease to end-stage kidney disease, but also complications such as increased risk for cardiovascular disease, cardiovascular mortality, all-cause mortality, and pregnancy complications. When the first living donor transplants were done, the first being an identical twin transplant in 1954, at least the first successful transplant, it was known that people born with a single kidney could live a normal life. And this was the justification for proceeding with living donor transplantation. It was only subsequent to that it was recognized that reduced GFR and any GFR below 60 was associated with risk for complications. And so it becomes important to study this topic to determine if living donors develop the same complications. In the general population, people with reduced GFR have the reduced GFR due to kidney or systemic disease, whereas in living kidney donors, the reduced GFR or reduced kidney function is due to nephrectomy. And it's not clear that the same risk exists in the general population. And real concern about long-term outcome in living donors came about 8 or 9 years ago with a publication of 2 articles comparing living donors to healthy selected controls. And both of these articles showed a small but significant increased risk of kidney failure in the living donors. One of them also showed an increased risk of cardiovascular mortality and all-cause mortality. However, there were a number of problems. The donors and the controls were from different eras, different environments. There's concern about some of the statistical analyses, but most importantly, the studies didn't take into account family history. We know that first-degree relatives of someone with kidney failure have an increased risk of kidney failure or kidney disease, even if they're not kidney donors. So the concern is whether this risk is really being a donor or the risk is being a relative, specifically a first-degree relative. The other concern that's been raised is pregnancy risk with living donation. Again, in the general population, women with chronic kidney disease have problems with pregnancy, including prematurity, hypertension, preeclampsia, and eclampsia. And the concern was that these same risks would apply to women after living donation. The data is mixed. There are some studies that show absolutely no risk after living donation. There are 3 studies, including one from the University of Minnesota, that reported a small increase in gestational hypertension and preeclampsia, but no other risks to the woman and the baby. So the point of this article was to review the overall risks, medical risks to the living donor, and to point out the controversies that exist. It's important to understand that the risks, as best as we know, are at worst very small. And the real reason to generate this information is not to discourage people from donation. We just think this is more information we can give to a donor candidate to help inform the donor-informed consent process. Most of the controversy is related to the lack of ability to get an appropriate control group to match the living donors. In terms of doing retrospective studies, ideally you would want individuals from the same era, from the same environment, from the same socioeconomic status, matched on important risk factors for chronic kidney disease, like family history, as I've already mentioned, but other things such as BMI, and also having normal kidney function on the date that corresponds to the date of donation. And to date, there's not been such a study. And we're limited to the retrospective studies that have been done with what I would call marginal control groups. Meta-analyses, though, of all the studies that have been done suggest that there really is not an increased risk of cardiovascular disease, but it's complicated in that the studies showing no increased risk have a shorter follow-up than the one study that does show an increased risk. And it may be that in that one study, the increased risk is because of longer follow-up. Other studies looking at kidney failure, again, with a shorter follow-up, have not shown an increased risk of kidney failure. But it's important to recognize that with a short follow-up, you're only looking at diseases that would appear relatively rapidly after donation. The two most common causes of kidney failure are the same as the two most common causes of kidney failure in the general population, and that is type 2 diabetes and high blood pressure. And both of these are diseases of aging, but they're also both diseases of lifestyle. And I think one of the real lessons we've learned over the years is that donors need to be counseled that being a kidney donor ought to come with a commitment to a healthy lifestyle. What we, both at the University of Minnesota and Mayo Clinic, are doing is a joint project to try and identify a suitable and ideal control group to compare the outcome of living donors compared to healthy selected controls. And we're hoping to identify controls that match the parameters that I alluded to before. Healthy at a date matching the time of donation, with normal renal function at the time of donation, matched on risk factors for kidney disease, and obviously matched in terms of environment and era. Obviously, donors, as they age, are going to develop the complications or morbidities that everyone else develops as they age. And the real question is there any risk that's truly attributable to being a kidney donor? And we hope in the next few years to be able to answer that question.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.